We need to make some changes to our services over the next few months, and it's really important that we hear from our service users what they think about those changes, and also we want people to get involved in helping us to make them. The reason why we have to make some changes is because over the last couple of years, more and more people have been coming to us for help and support, which is great because it means that people know we're there and we want to be able to help those people. But it actually means that we've had more and more demand, and that means more and more pressure on our services. And we haven't actually had any more funding from health or from councils so that we can see more and more people. Alongside this, the coronavirus pandemic has really changed the way that we're working with people, and we need to make sure that we're offering the support that we can offer now and also in the future in the best way possible, using the resources and funding that we've got. And we also know that lots and lots of people are going to be really adversely affected by the coronavirus pandemic, and it's going to affect their mental health. So we're expecting that more people will want to come to us for help, and we want to be able to help as many people as we possibly can. So those are the reasons why we need to make some changes. There are 4 main ways that we're going to change things. Firstly, from spring 2021, we're planning to introduce one phone number and one email address for everybody who needs to contact us. We're doing this because it's been very difficult for us, with lots of staff working at home, having lots of different phone numbers and having to redirect building phone numbers to home mobiles and so on and so forth. And also we want to make the experience that people have when they contact us, we want to make that more reliable and more consistent. And we also want to be able to give people really, really good advice and information when they make contact with us, and also to have staff doing that who are really dedicated to that role and that function. And also we hope to be able to offer volunteer opportunities for volunteers to be able to support that as well. The second thing is that we want to use our website more effectively. We want to be able to have lots of really great training for people, self-help resources, tips, advice, and lists of apps, things like that, so that everybody can have access to some kind of help from us 24/7. Thirdly, we need to make sure that our trained and experienced mental health staff are using their time in the most effective way, and also being able to see as many people as possible given the number of people who want help from us. So we're going to make sure that those staff give really good quality support to people by having a good assessment, and then having the opportunity to have some individual support sessions, but those sessions will be focused and time limited. And in addition to that, we also know that sometimes people who we're supporting need some help urgently, and we are going to offer people the opportunity to contact us, but we're going to have specific times when that's available to people. And if people need help outside of those times, we'll be supporting people to have a good plan about who else they can contact when they need help outside of those times. The fourth area that we're going to make some changes around is about how we support people to give and receive peer support from each other, to be able to do activities, to have social contact with people, and to feel that they can connect with other people who we're supporting. We want to be able to involve volunteers more significantly in how we offer those activities. We also want to offer those kinds of social connection opportunities to individuals we support in a more longer term way. And we are looking at the idea of kind of creating something that we've called Mind Club, where people who are getting mental health support from us can join a social and activities and creative activities club and enjoy access to a range of opportunities that will be facilitated by some staff but also by volunteers as well. And when they're no longer receiving mental health support, those individuals can carry on accessing those social opportunities in a longer term way. And also what we're really wanting to do is to encourage more people that we're supporting to get involved in delivering those activities and also volunteering for us, and also supporting people to then move on perhaps into volunteering outside of our organisation and also into employment as well. We'll be offering our mental health support in different ways. We'll be offering it to a small number of people face to face as the government guidance allows us to do that, but we'll also be offering it by video call and video conference and also by phone. And we think that the combination of those three ways of supporting people will be the way that we're going to be working with people for the foreseeable future. We're also going to continue to try and offer a wide range of workshops and courses linking to the Recovery College as well, that help people to develop their skills and confidence around managing their own mental health and understanding how their mental health impacts on them and what they can do to make a difference. We know that face-to-face support is really important to people, and we are really committed to keeping our buildings and also to trying to offer face-to-face support as and when we can, and to increasing that if things ease and we're allowed to do more of that within the guidance that there is at the moment.